Part A. Extract 1. Questions 1 to 12. You hear a nurse talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Hello, Mihiraa. I'm Boney Jim, one of the nurses here. What brings you in today?
Hi, Boney. I'm really worried. I've been experiencing severe stomach pain over the past week, and it's getting worse. I thought it might go away on its own, but now I'm not so sure.
I see. Could you describe the pain for me? When did it start, and is there anything that seems to trigger it?
It started about a week ago, just as a dull ache in my lower abdomen. I didn't think much of it at first, but over the next few days, it got progressively worse. Now, it's a sharp, constant pain.
I'm sorry to hear that, Mihiraa. Well, did you notice any triggering factors?
Yes, I've noticed it's particularly bad after I eat, especially if I have something spicy or fatty. I've tried to avoid those foods, but even mild meals seem to trigger discomfort now.
That sounds quite uncomfortable. Have there been any episodes where the pain was particularly severe?
Yes, a couple of nights ago, I had to wake up my husband because the pain was so intense. I was sweating, felt nauseous, and couldn't find a comfortable position. It lasted for about 2 hours before it subsided a bit. That's when I decided I needed to see a doctor because I was really scared.
It's good you decided to come in. Have you tried any remedies or medications to alleviate the pain?
Yes, I've tried a few things. Initially, I took some over-the-counter antacids thinking it might be heartburn, but they didn't help much. Then, I tried some painkillers like ibuprofen, but they only provided temporary relief. I also tried drinking peppermint tea, as a friend suggested it could soothe my stomach, but the pain persists.
I understand. Let's gather some more information about your medical history. Do you have any family history of gastrointestinal issues or other significant health problems?
Well, my mother had similar stomach issues, but they never figured out exactly what was wrong. She managed with diet changes. I also have a history of IBS, but this feels different. It's more intense and not relieved by the usual treatments I've used for IBS in the past.
How about your social history? Any habits like smoking or alcohol consumption that we should be aware of?
I don't smoke, but I do have an occasional glass of wine with dinner. I also drink coffee, but only 1 cup in the morning. I've tried cutting out the wine and coffee since the pain started, but there's been no significant improvement.
Thank you for sharing all this information, Mihiraa. Given your symptoms, I think it's important we run some tests to get to the bottom of this. We'll start with some blood tests to check for any signs of infection.
Okay, all right.
We might also need to do an ultrasound to look at your abdominal organs, and possibly an endoscopy to examine your digestive tract more closely.
That sounds like a good plan. I'm really hoping to find out what's wrong and get some relief.
We will do our best to get to the root of the problem. In the meantime, I'll prescribe you some medication to help manage the pain. We can try a proton pump inhibitor to reduce stomach acid, and I'll give you some stronger pain relief as well.
Thank you so much, Boney. I appreciate all your help. I'll start the medication.
You're welcome, Mihiraa. Also, I recommend you keep a food diary to track anything that might exacerbate your symptoms.
Thank you so much, Boney. I appreciate all your help. I'll start the medication.
Surely, I will keep the notes. Hopefully, the tests will give us some answers.
Yes, we'll be in touch soon with your test results. Take care, Mihiraa.
Extract 2. Questions 13 to 24. You hear a physiotherapist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Hi Mihiraa, I'm Mabel Linton, your physiotherapist. How can I help you today?
Hello, Mabel. I've been experiencing severe neck pain for the past few weeks, and it's really affecting my daily activities. I need some relief and guidance on what to do.
I'm sorry to hear that. Can you describe how you're feeling right now?
Right now, the pain is a constant, dull ache, but it occasionally sharpens when I move my head in certain directions. It's worse in the morning when I wake up and at the end of the day. I'm also feeling some stiffness and a bit of tingling down my right arm.
That sounds quite uncomfortable. Can you tell me more about how the pain started and any specific events that may have triggered it?
It all started about 3 weeks ago after a long workday at my desk. I remember sitting in a particularly bad posture for hours without taking breaks. The next morning, I woke up with a stiff neck, and the pain has gradually worsened since then. I've also noticed that it gets aggravated when I spend too much time on my phone or computer.
I see. Have you tried any treatments or medications to alleviate the pain?
Yes, I've tried a few things. I took some ibuprofen, but it didn't help much. A friend recommended Voltaren gel, which provided some relief, but it's only temporary. I also used a heating pad, which feels good at the moment but doesn't seem to solve the problem. I've even tried some neck stretches I found online, but they sometimes make the pain worse.
Thank you for sharing all that. Based on your description, it sounds like you might be dealing with a condition called cervical radiculopathy, often caused by poor posture or prolonged strain on the neck muscles. We'll need to conduct a few assessments to confirm this.
That makes sense. What exactly does that mean?
It means there's likely some compression of the nerves coming from your cervical spine. This can result in pain, stiffness, and even numbness in your arms. It's quite common in people who spend long hours in static positions, like at a desk or using a phone.
Oh, that definitely sounds like my situation. What can I do to improve it?
First, we'll need to make some changes to your lifestyle to prevent further strain. Adjusting your workstation to ensure proper ergonomics is crucial. Your computer screen should be at eye level, and you should take frequent breaks to stretch and move around. Avoiding prolonged use of handheld devices and practicing good posture are also essential.
I'll definitely work on those adjustments. Anything else I should consider?
Yes, we'll start with gentle stretches. I also recommend some specific exercises to strengthen the neck and shoulder muscles, which can help alleviate the pain and prevent future episodes. And gradually move to strengthening exercises as your condition improves. Additionally, using a supportive pillow that keeps your neck in a neutral position while you sleep can make a significant difference.
That sounds manageable. What about medications?
For medication, you can continue using the gel for temporary relief. However, I would also suggest talking to your doctor about potentially using a muscle relaxant like Flexeril to help with muscle spasms. In some cases, a short course of oral steroids might be prescribed to reduce inflammation, but this would need to be discussed with your primary care physician.
I'll make an appointment with my doctor to discuss those options. Thank you so much, Mabel. I feel more hopeful about managing this now.
You're welcome, Mihiraa. Remember to start with the lifestyle changes and then exercises, and we'll follow up in a week to see how you're progressing. If the pain worsens or you notice any new symptoms, Please let me know immediately.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a pharmacist called Mihiraa talking to a nursing manager. Now read the question.
Mihiraa, the anti-dandruff shampoo you're looking for is ketoconazole-based. It's potent, but it can be drying. We recommend alternating it with a gentler, moisturizing shampoo like the one containing pyrithione zinc. Remember, consistency is key. Use it twice a week for a month, then reduce to once a week for maintenance. While it's effective, it might take a few weeks to see significant improvement. Also, avoid hot water as it can irritate your scalp.
So, I should use the ketoconazole shampoo every other day for a month, then just once a week? And I should use a different shampoo on the other days?
That's right. The pyrithione zinc one will help balance your scalp. Now, ketoconazole can sometimes cause a slight initial increase in dandruff before it clears up. Don't be alarmed if that happens. It's a temporary reaction. Also, while rare, some people experience mild itching or redness. If it gets worse or doesn't improve, let us know.
Okay, got it. So, I should watch out for itching too.
Exactly.
Now look at question 26. You hear a surgeon talking to a nurse called Mihiraa. Now read the question.
Mihiraa, we're scheduling the laparoscopic cholecystectomy for Mrs. Paul tomorrow. Given her history of adhesions from a previous surgery, we'll need to be extra cautious. I want you to double-check the CO2 insufflation settings. We'll be using the harmonic scalpel for dissection, but have the electrocautery ready as a backup.
Got it. I'll verify the insufflation settings and prepare both the harmonic scalpel and the electrocautery. Should we anticipate any specific challenges due to the adhesions?
Absolutely. Adhesions can distort the anatomy, making identification of structures more difficult. We might encounter increased bleeding, so be prepared with additional suction and cautery. Also, ensure we have adequate lighting. The Zeus camera is preferred, but if there's an issue, we'll switch to the HD camera.
Understood. I'll confirm the equipment and lighting. Should we anticipate any specific postoperative complications given the adhesions and the laparoscopic approach?
While laparoscopy generally results in less postoperative pain, adhesions can increase the risk of wound infections. So, emphasize meticulous wound care in the post-op instructions. Also, monitor her for signs of bowel obstruction closely, as adhesions can contribute to that.
Now look at question 27. You hear a nurse talking to a junior nurse called Mihiraa. Now read the question.
Mihiraa, pagers might seem old school, but they're still crucial in this environment. Sure, they're one-way communication, but their reliability is unmatched. You'll get paged for everything from lab results to urgent patient needs.
I understand, but what about privacy? Anyone can see the number on the pager.
That's a valid concern. We have a code system to address that. Numbers correspond to specific situations. For instance, 101 is a general call, while 203 might indicate a code blue. It's essential to memorize these codes. Also, always prioritize urgent pages, like those starting with 2.
Got it. So, I should always carry the pager, even during breaks?
Ideally, yes. Emergencies can happen anytime. But if you absolutely must step away, inform the charge nurse. They can redirect urgent pages to someone else. Remember, a missed page could have serious consequences.
Now look at question 28. You hear a diabetologist talking to a patient called Mihiraa. Now read the question.
Mihiraa, gestational diabetes is a temporary condition that develops during pregnancy. It's crucial to manage it closely for both you and the baby's health. While diet and exercise are often sufficient, we might need to introduce insulin if blood sugar levels don't stabilize.
I'm a bit worried about insulin. Will it harm the baby?
Absolutely not. Insulin is a natural hormone. In this case, it helps your body use glucose effectively. It's a tool, not a treatment. Regular monitoring, a balanced diet rich in fiber, and moderate exercise are still essential.
Okay, I understand. But what about weight gain? I've heard conflicting advice about how much weight is safe to put on during pregnancy.
It's individual, but generally gradual and steady weight gain is recommended. Focus on nutrient-dense foods. Avoid excessive sugary drinks and refined carbohydrates. Your midwife or dietitian can provide more tailored guidance. Remember, it's not just about the number on the scale, but about overall health.
Now look at question 29. You hear a GP talking to a nurse called Mihiraa. Now read the question.
Mihiraa, I'm concerned about Mr. Peters. His blood pressure readings have been consistently high, despite medication adjustments. We need to schedule a follow-up in 2 weeks to reassess his condition. Also, I've noticed some unexplained weight loss. I want you to schedule blood tests to check for any underlying issues.
Got it, Dr. Link. I'll schedule the follow-up and blood tests. Should we refer him to a specialist if the blood pressure doesn't improve?
Let's see how the next appointment goes. If there's no significant improvement, we might consider a nephrologist. But for now, let's focus on optimizing his current medication. Also, emphasize the importance of lifestyle changes, diet, exercise, and stress management.
Will do. And about his medication, should we explore alternative options if he experiences side effects?
Absolutely. We can adjust the dosage or try a different class of medication if needed. But let's prioritize compliance with the current regimen first. It's crucial for controlling his blood pressure.
Now look at question 30. You hear a nursing manager talking to a nurse called Mihiraa. Now read the question.
Mihiraa, I need you to keep a close eye on Mrs. Soni in room 302. She's post-op from a hip replacement and is showing signs of early delirium. We need to prevent her from trying to get out of bed, as that could dislodge the hip implant.
Understood, Linda. I'll increase her observation and make sure the bed alarms are on. Should I start her on anti-delirium medications?
Not yet. Let's try non-pharmacological interventions first. Ensure she's well hydrated, oriented to her surroundings, and has adequate pain control. We can reassess in a few hours. Also, involve her family in her care as much as possible.
Okay. I'll make sure to keep the family informed and involved. Anything else I should be aware of?
Yes, her oxygen saturation levels have been fluctuating. Keep a close watch on that. If it drops below 92%, notify me immediately. We might need to increase her oxygen flow.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear a cardiologist called Mihiraa being interviewed about her career.
Dr. Mihiraa, thank you for joining us today. Your work in cardiology is truly inspiring. Let's start with a broad question. How has the field of cardiology evolved since you began your career?
It's a pleasure to be here. The transformation in cardiology is nothing short of revolutionary. When I started, the diagnostic tools were primitive compared to today's standards. We relied heavily on physical examinations, electrocardiograms, ECGs, and echocardiograms. Now, we have advanced imaging techniques like CT scans, MRIs, and nuclear imaging that offer unparalleled insights into the heart structure and function. The advent of minimally invasive procedures has transformed treatment paradigms. For instance, angioplasty and stent placement have become commonplace, replacing open heart surgeries for many conditions. The most significant shift, however, is our understanding of heart disease at a molecular level. This knowledge has opened doors to targeted therapies and personalized medicine.
That's fascinating. Can you share a particular event that stands out as the most memorable in your career, Mihiraa?
There are countless moments that have shaped my career, but one incident sticks out. It was a young athlete who collapsed during a marathon. When he arrived at the hospital, he was in cardiac arrest. We managed to revive him, but the underlying cause was a rare heart condition. The challenge was to stabilize him while simultaneously investigating the root of the problem. We eventually diagnosed a hypertrophic cardiomyopathy with a unique genetic mutation. This case underscored the importance of considering rare diagnoses, even in seemingly straightforward scenarios. Moreover, It highlighted the critical role of a multidisciplinary team involving geneticists and cardiologists in managing complex cases.
That must have been incredibly challenging. Mihiraa, what was the toughest case you've encountered?
Every patient presents unique challenges, but one case stands out for its complexity. It was a patient with refractory heart failure. Despite optimal medical management and even a heart transplant, their condition continued to deteriorate. The patient's quality of life was severely compromised, and there seemed to be no definitive answer. We explored experimental therapies, including stem cell therapy, but with limited success. This case was a stark reminder of the limitations of our current knowledge and the emotional toll that chronic heart disease can take on both patients and healthcare providers. It also emphasized the need for continued research to find novel treatments for refractory heart failure.
It's evident that cardiology is a field of constant learning. What do you consider, Mihiraa, as the greatest advancement in cardiology during your career?
The development of cardiac implantable electronic devices, CEDs, has been a game-changer. These devices, including pacemakers, defibrillators, and cardiac resynchronization therapy, CRT, have dramatically improved the lives of countless patients. The miniaturization of these devices and the advancements in battery technology have made them more reliable and comfortable for patients. Moreover, the ability to remotely monitor these devices has revolutionized patient care. However, the true impact lies in the reduction of mortality and morbidity associated with arrhythmias and heart failure.
Given the prevalence of heart disease, Mihiraa, there must be certain conditions you encounter more frequently. Can you shed light on that?
Coronary artery disease, CD, remains the leading cause of heart-related deaths globally. It's a complex condition influenced by a multitude of factors, including genetics, lifestyle, and environmental exposures. Other heart conditions like hypertrophic cardiomyopathy further complicate the cardiovascular health landscape. The management of CED has evolved significantly over the years, with a greater emphasis on risk factor modification, early detection, and preventive measures. However, despite these advancements, the burden of CED persists, necessitating ongoing research and public health initiatives. According to WHO, heart failure significantly impacts global health.
Finally, Dr. Mihiraa, what advice would you give to aspiring cardiologists?
Cardiology is a demanding but incredibly rewarding field. It requires a strong foundation in basic sciences, clinical skills, and critical thinking. Continuous learning is essential as the field is constantly evolving. Building strong relationships with patients is paramount. Empathy, communication, and compassion are as important as medical knowledge. Additionally, I encourage aspiring cardiologists to develop a keen interest in research. By contributing to the advancement of knowledge, we can improve patient outcomes and shape the future of cardiology.
Now look at Extract 2. Questions 37 to 42. You hear a physician talking about the complications the multivitamins created for a patient called Mihiraa. You now have 90 seconds to read questions 37 to 42.
Good morning, everyone. Today, I want to delve into a particularly intricate medical case involving a patient named Mihiraa. This case highlights the often overlooked complexities of seemingly innocuous substances like multivitamins. It's a stark reminder that even the most well-intentioned supplements can have unforeseen consequences when interacting with other medications. Mihiraa presented with a constellation of symptoms that initially appeared unrelated. It began with a progressive onset of fatigue, which she attributed to the rigors of her demanding job. Over time, this fatigue escalated, accompanied by intermittent dizziness and a peculiar tingling sensation in her extremities. Her appetite dwindled, and she noticed a subtle yellowing of her skin and eyes. These seemingly disparate symptoms were the first cryptic messages of an underlying, complex medical issue. Given the nonspecific nature of Mihiraa's initial symptoms, our initial approach was comprehensive. We conducted a thorough physical examination, ordered a battery of blood tests, and explored her medical history in detail. Her past medical history was unremarkable, save for a history of mild hypothyroidism managed with levothyroxine. Intriguingly, she had recently started taking a multivitamin supplement to address perceived nutritional deficiencies. As our investigations progressed, a clearer picture began to emerge. Her blood tests revealed elevated liver enzymes, indicative of liver inflammation. The yellowing of her skin and eyes, a condition known as jaundice, further corroborated hepatic involvement. The tingling sensation in her extremities, often referred to as paresthesia, suggested a potential neurological component. These findings, coupled with the temporal relationship to the initiation of the multivitamin, led us to suspect a case of drug-induced liver injury. The culprit behind Mihiraa's predicament was an unfortunate interaction between her multivitamin and her levothyroxine. While multivitamins are generally considered safe, they contain a variety of minerals, including iron. Iron, in excess, can impair the absorption of levothyroxine, a synthetic thyroid hormone crucial for regulating metabolism. This unintended consequence led to undertreated hypothyroidism, which manifested in the fatigue, dizziness, and neurological symptoms Mihiraa experienced. Moreover, the accumulation of thyroid hormones can exert toxic effects on the liver, resulting in the observed liver inflammation and jaundice. One of the most feared complications of drug-induced liver injury is fulminant hepatic failure, a rapidly progressing condition where the liver fails catastrophically. In such cases, the liver's ability to detoxify substances, produce essential proteins, and regulate blood clotting is compromised. The patient deteriorates rapidly, often requiring intensive care and potentially a liver transplant. Fortunately, Mihiraa's condition did not progress to this dire stage. Our management of Mihiraa's case focused on two primary objectives: addressing the liver injury and correcting the underlying thyroid dysfunction. We discontinued the multivitamin immediately and adjusted her levothyroxine dose. Supportive measures, including adequate hydration and nutritional support, were implemented. Close monitoring of liver function and thyroid hormone levels was essential. Over time, with appropriate management, Mihiraa's liver enzymes normalized, and her thyroid function returned to within the reference range. Her symptoms gradually resolved, and she made a full recovery. This case underscores the importance of a comprehensive medical history and a vigilant approach to medication management. Even seemingly innocuous substances like multivitamins can have unintended consequences when interacting with other medications. It is crucial to consult with a healthcare provider before starting any new supplement, especially if you have underlying medical conditions. By understanding the potential risks and benefits, we can minimize the likelihood of adverse events.